Welcome, everyone. Great to see a big turnout tonight on a snowy evening. As Jacqueline says, nice to have it virtual. I'm talking tonight about bovine respiratory disease and work that we've done over the past 5, maybe 10 years on kind of a new understanding of how that disease develops. So my aim tonight is to cover just briefly what our existing or prior understanding of bovine respiratory disease is and how that disease develops, a little tiny bit on some new insights or some new twists on the bacteria that cause bovine respiratory disease, and then present to you some evidence that the risk factors for bovine respiratory disease may be acting to promote inflammation, and perhaps it's that inflammation which increases PRD risk, which is different from how we have traditionally understood that disease, and of course, why we would care about that. I want then to switch gears a little bit and focus on one type of bovine respiratory disease that caused by Mycoplasma bovis, and just show some related information about the idea that inflammation, again, early on in the course of disease, seems to worsen the outcome of animals infected with Mycoplasma bovis. So this has been my understanding of bovine respiratory disease since I was probably 15 years old or something like that. The idea that the risk factors that I think are quite well known, stress, viral infection, transportation, et cetera, that those act to predispose calves to respiratory disease because they suppress innate immune responses. And by innate immune responses, I mean the natural ability that we all have to fend off infections. Calves have an ability to do that, and the thinking is that that ability gets suppressed in the face of the risk factors that we commonly see. And then because of the suppression of those innate immune responses, Mannheimia bacteria that are normally present in the nasal cavity of many healthy calves take advantage of that immunosuppression to penetrate down into the lung, colonize the lung, and therefore cause disease. So this was a paper I wrote back in 2014 where I explained all of that in quite a bit of detail. And now I have cause to think I'm not quite sure if that tells the whole story. There are a few problems that we've had over the years that we've thought about with this scenario. Problem number one is kind of a philosophical one, the idea that if you are acutely stressed, that the body's response to that would be to suppress immunity or suppress the ability to fight off infection. That seems, on the face of it, not a very good strategy, because you would think when you're experiencing a stressful circumstance, most of your other body's responses are to allow you to adapt to that. But it would seem that suppressing the defense against infectious disease would seem counterproductive to that. This is a second problem that we chatted about at some length, and it involves this bit, the idea that Mannheimia bacteria are in the nasal cavity of many healthy calves, and then they penetrate down into the lung when those innate defenses are reduced. We've known for a long time, this paper was written in 1983, we've known for a long time that there are two types or two serotypes of Mannheimia hemolytica. This would be the bacterium that very, very commonly causes bovine respiratory disease. And we've known for a long time that serotype 1, which confusingly, if you classify it by the genetic material in the nucleus, is called genotype 1, but ignore that for now. Serotype 2 certainly is present in many healthy calves, but that serotype is less likely to cause disease, whereas serotype 1 is uncommon in healthy calves. We usually don't see that serotype before cattle are weaned or commingled, but then after that it becomes more common. And this is the major serotype that we identify in diseased animals. So way back in 1983, this was identified. Serotype 2 was the predominant isolate at the cow-calf farm, and serotype 1 was the predominant isolate in the feed yard and from the lungs of cattle that had respiratory disease. And we've certainly seen that in our studies as well. This was a study we did at the Ontario Beef Research Centre several years ago, and you can see in red, Mannheimia hemolytica serotype 1, which is the one that we think it mostly causes disease, is very, very infrequent at day one after, these were auction calves, at day one after arrival to the feedlot barn, but by day 4 and 7, it was much more frequent. Whereas in orange, Mannheimia hemolytica serotype 2 was the one that was quite frequent on arrival and remained relatively high and then subsequently declined. So when we look at the onset of disease, which is shown by the red line, it seems to mimic most closely the pattern of serotype 1 rather than serotype 2. So the point of all of this is this idea that Mannheimia is present in many normal animals and penetrates into the lung when exposed to these risk factors is partially true, but it's a different bacterium that's present in the healthy cattle, and it's serotype 1 that becomes more prevalent as these calves experience BRD risk factors. The thing that has changed with this whole scenario is that now it used to be very difficult to distinguish these different serotypes because you needed special reagents, but now at Animal Health Lab here in Guelph and probably other diagnostic labs across Canada, just the routine testing to identify Mannheimia hemolytica can distinguish these two genotypes and therefore distinguish those two types of bacteria. So this was another problem with our existing understanding of how bovine respiratory disease happened. But we ignored all of that. We were interested in this idea that if risk factors reduce innate immunity, and that is what results in predisposition to bovine respiratory disease, then all we would have to do is during that brief window of susceptibility when cattle come into feedlots, we would just have to boost that innate immune response and we would be able to prevent disease. So we went about that by, and again, this was work done at Ontario Beef Research Centre. We purchased 60 high-risk auction calves. These were low body weight calves, multiple sources, and no more than 2 animals from a single source. They came in as 4 different cohorts and did not receive antibiotics on arrival. We randomized those calves by weight pairs, and then in the next slide, I'll show you the details of this stimulant, but half of the calves received an aerosol innate immune stimulant, and the other half of the calves were controls that received saline. And we took a lot of measurements from these calves and just watched the outcome. And the intention was that these calves that received the innate immune stimulant would be protected against disease, and unfortunately, these control calves might have a higher prevalence of disease. I don't want to get too technical here, but this was the innate immune stimulant. Essentially, we took different bacteria from what caused bovine respiratory disease. We killed those bacteria and essentially ground them up. And we showed that if we put that preparation on bovine cells, that we would get higher expression of this so-called antimicrobial peptide, which people refer to as a natural antibiotic. It's something produced by the calf that naturally kills bacteria. So higher levels of that we thought would be good and part of this innate immune response. We also found that different chemical mediators of inflammation were also increased as a result. This was actually in calves rather than looking at just in cells. The levels of these chemical mediators were increased, and similarly, the cells that kill bacteria within the lung tissue. This is a lung wash where we put an endoscope down into the lung and put in fluid and then recover back both cells from the lung and fluid. And you can see a lot of these cells, neutrophils that we know are able to ingest and kill bacteria that are not present in the saline treated calves. So this gave us some good evidence that the intervention we were doing, the aerosolized stimulant, really was stimulating an innate immune response. This is the data from these calves. The calves that were aerosolized with this bacterial lysate, with the innate immune stimulus, they get a transient fever, and I think that's just the response to the bacteria that are the killed bacteria that are aerosolized into the lung. I should mention that we didn't infect these calves with any live bacteria. This is just natural bovine respiratory disease that we're studying here. We can see a little bit of a, maybe our first hint that something is going wrong here. Again, I would emphasize that it should be our hypothesis was that it would be the control calves that had more disease, and the lysate, the innate immune stimulus, would protect these calves from disease. But these calves seem to be spiking the fever later on during the study. This would be another indication, the weight gain. So I think it's pretty clear here that these calves that receive the innate immune stimulant are doing quite a bit worse than the control calves. And in fact, they never gained weight and lost quite a bit of weight over the course of the study. We also looked at the frequency of bovine respiratory disease. And again, we thought that the lysate or innate immune stimulant treated calves would have been protected against disease, but in fact, it was the opposite. This was not statistically significant, the difference, but the opposite of what we anticipated. And over the course of that study, 72% of those lysate-treated calves that were supposed to be protected against disease ended up having to be treated for BRD compared to 53% of the control animals. We did have some deaths in this study as well. These were pretty high-risk calves, and those deaths occurred as a result of Mycoplasma bovis pneumonia, and I'll come back later and talk about that. But again, this was a statistically significant difference, more deaths in the lysate-treated calves compared to only one in the control group. So this was not at all the way we hoped that this study would pan out, but we think that something quite useful emerged from it, because it gave us a little window into a different way to think about bovine respiratory disease. And specifically, we know that innate immune stimulant not only stimulates innate immune responses, but also stimulates inflammation within the respiratory tract and the lungs. So it made us wonder if early inflammation at the time these calves were still healthy, they're not showing any clinical signs, but if early inflammation in the pre-disease state might be increasing the later risk of development of bovine respiratory disease. That made us kind of look back at some earlier work that we had done and look at it in a little bit different light. So this was work from quite a few years ago, just looking at different proteins within lung wash fluid. So again, we put an endoscope down into the lung, put in some fluid, and then recover proteins and cells that are down in the lung of these calves. We can see that at before stress versus after stress, so before weaning and transport or after weaning and transport, there seems to be a reduction in the level of this anti-inflammatory protein, which is called odorant binding protein, but I'm not going to go into the details of that. And that sort of fits with the current findings that it seems that stressful circumstances like weaning and transportation seem to reduce the anti-inflammatory proteins in the lung, and that might be anticipated to create a more inflamed state that perhaps predisposes to respiratory disease. Different study, this one 2013. Again, we looked at a lot of proteins within lung wash fluid. We collected this fluid from healthy calves at 1 to 2 days after weaning and transportation, and then we just waited to see which ones developed respiratory disease versus which ones did not. And the ones that remained healthy had higher levels of several anti-inflammatory proteins, whereas those that later developed bovine respiratory disease had lower levels of these anti-inflammatory proteins at this stage where they were still clinically healthy. So again, it supports the idea that the calves that can't properly control their inflammatory responses are maybe the ones that end up developing respiratory disease. And then just one last example, this was the same paper as the first one. These calves, again, were weaned and transported. There was a control group that was not weaned and transported, and the black group was weaned and transported. And then at 24 hours after they arrived to the feedlot, we delivered an inflammatory stimulus into the lung, and you can see that there's a higher response in the stressed cows compared to what we saw in the non-stressed cows. So again, it was a counterintuitive idea at the time, but looking back on it, it supports that idea that calves that are recently weaned and transported and exposed to other respiratory disease risk factors seem to have a pro-inflammatory state within their lung that may perhaps predispose to respiratory disease. So the summary of this first part then is that in cattle at risk of bovine respiratory disease, it seems that inducing respiratory tract inflammation, in this case with our aerosolized innate immune stimulus, that seems to worsen clinical outcomes with respect to development of respiratory disease. And secondly, we wondered, based on that, does early subclinical inflammation, meaning inflammation in calves that are still visibly healthy, they don't show any clinical signs of disease, is that a way in which BRD risk factors promote respiratory disease in high-risk calves? And I should say, if we're just, and I mean this respectfully, but if we're just telling stories to veterinary students or telling stories to ag students about how respiratory disease develops, maybe it doesn't really matter too much which of those is true. But if we want to intervene in this process and try to do something to better prevent respiratory disease, then of course it's very important to know if we should try to boost or reduce the development of that immune and inflammatory response. So we went back to Ontario Beef Research Centre. This was, I think, the first study that was done in the new feedlot barn. And we tried to ask the question, might BRD risk factors promote inflammation? So for this study, we looked at three different groups. We looked at what we've called low-risk calves, single source. These came from OBRC. They were weaned by two-stage weaning. They were not commingled with other calves, and they were not transported. We had a group of medium risk calves, again from OBRC, so single source. They were subjected to abrupt weaning, but still no commingling or transport. And then we had a larger group of what we've called high risk calves. And again, these were auction calves, very similar to the previous study. I should say the analysis of this data is still underway. So these are just preliminary findings, and I don't have the final result of this yet. But here are a few data. So here again, we're looking at the number of neutrophils, the number of inflammatory cells within that lung wash fluid, and these would be an indication of inflammation deep down in the lung tissue. And you can see that compared to the low and medium risk calves, and especially down here compared to the low risk calves, that some of these higher risk calves are developing inflammation within their lung, even on day one after arrival to the feedlot. And again, these calves are healthy at the time they are arriving. We did some other work, and again, I'm not going to go into details, but this is a marker of how macrophages, another type of white blood cell within the lung tissue, how those cells are becoming activated. And you can see the similar story here, that compared to the low risk calf, that to some extent the medium risk calves and especially the high risk calves seem to have more activation of those cells, again, indicating an inflammatory response in the lung. So more analysis left to go on that, but it seems to support that hypothesis that even though those calves are still healthy, they're experiencing inflammation within their lung tissue as a result of those BRD risk factors. After we developed some of those ideas, I presented them at a conference, and it quickly became apparent that some other people were finding things that were quite similar. So Matthew Scott, who's now at Texas, and Amelia Willems at Mississippi State University had independently stumbled upon sort of a similar scenario. They did kind of a similar experiment where they brought calves into a feedlot, and they took samples on arrival to the feedlot and then compared calves that remained healthy versus calves that later developed bovine respiratory disease. And similar to us, they found in the calves that later developed bovine respiratory disease, they found that cells within the blood had increased expression of genes that are usually thought to dampen or reduce inflammatory responses. And that kind of aligns with what we saw in the 2013 study. And conversely, a decreased expression of genes that were thought to fight off bacteria. So it's work that very much aligns with what we saw. It's interesting, though, that we, in our work, are looking mainly at local responses within the lung. So we put an endoscope into the lung and figure out what's going on within the lung tissue, whereas this group is looking at blood cells. So they're looking at more what's going on body-wide within the blood of those calves. But we seem to be coming up with a similar scenario. So summary of this part, it was previously considered that bovine respiratory disease risk factors suppress innate defenses, and that allows bacteria to invade into the lower respiratory tract, into the lung. But that, and I haven't mentioned this before, but there's been a lot of work done on innate immunity in bovine respiratory disease, and it's quite a mixed bag. It seems that some innate immune defenses are increased and others are reduced, and others don't change at all in calves that are experiencing these risk factors. I would like to suggest that evolutionarily, it would be a better strategy to boost your responses if you're in a period of stress and risk of infectious disease. And this work that we're leaning into seems to suggest that that's the case. So preliminary evidence of respiratory tract inflammation in healthy cows that are experiencing those BRD risk factors. Again, maybe it doesn't matter if we're just telling stories to each other, but if we want to develop better strategies for disease prevention, then knowing the direction that we want to change those responses and the details of how to change the responses within the lung tissue become quite important. I want to switch gears just a little bit and talk about Mycoplasma bovis, and I thought I would start off just by putting it in context of the variety of causes of bovine respiratory disease. I am a veterinary pathologist, so my window into understanding respiratory disease is largely dead animals and sliced images of lungs, so I hope you're not offended by that. I'm just going to go through this very, very briefly, but if you want more information sometime, I'm happy to chat in more detail about the different causes of bovine respiratory disease. This is shipping fever. This is a very well-known, classic, and very common cause of respiratory disease in recently arrived feedlot cattle. The cause of this disease has been known for a long period of time. Mehemia hemolytica, Histopheles somni, Pasteurella maltosida. And this is, again, very typical of the acute respiratory disease after cattle arrive to feedlots. Histopheles somni, a disease mainly seen in feedlots. That bug can cause shipping fever pneumonia, but can also cause this inflammation on the outer surface of the lungs. So fluid fills up the space within the chest cavity between the lung and the body wall. So another common cause of respiratory disease in feedlot cattle. We know a lot about viral causes of respiratory disease, and bovine respiratory syncytial virus and bovine coronavirus and parainfluenza virus would be the main types of that. Another virus, herpes virus, infectious bovine rhinotracheitis, or IBR, typically causes these tracheal lesions. You can see all of this debris in the trachea of this calf as a result of that herpes virus infection, and then secondarily bacterial pneumonia. This is acute interstitial pneumonia, or so-called AIP, of feedlot cattle, a disease that I think it's fair to say no one really knows what the cause of that disease is, but probably somehow related to feeding and rations that promote rapid growth. But again, a well-recognized condition in feedlot cattle. At the bottom, a few causes of respiratory disease that are a little bit less common in Ontario. Lungworm, this is a section of lung, and you can see coming out of this airway or bronchus, you can see these little thread-like worms. We don't see this disease very commonly in Ontario, but I know that it is present in Ontario, and my suspicion is that it's more common probably than we give it credit for, but certainly not a common cause of respiratory disease in cattle in Ontario. This would be a so-called embolic pattern, so animals that have liver abscesses or have infections of the heart valve may have bacteria spread from these primary sites and reach the lung and cause little abscesses within the lung tissue. And then finally, a disease that is, finally, bovine tuberculosis, which of course is a disease that Canada is officially free of, but rears its ugly head from time to time in Canada, but fortunately rarely. And Canadian Food Inspection Agency personnel go in and eliminate that disease. So hopefully a disease that we don't see frequently. So that's kind of a range of different causes of respiratory disease that we see in cattle. But I think a unique one of those that is quite a common and I think quite important form of respiratory disease would be that caused by Mycoplasma bovis. These would be a very characteristic appearance of the lung of cattle with Mycoplasma bovis pneumonia. This is the normal lung here, so there's probably only maybe 20% of the lung that calf is still breathing with. The rest of it is not only discolored, but very, very firm. There's really no air left within that lung and no chance at respiration there. And then the very characteristic abnormalities that we see in the lung that's relevant to what I'm going to talk about later are these so-called caseo-necrotic lesions. They're little tiny nodules of where there's been death of cells within the lung tissue. And we don't see that in other forms of respiratory disease. And it's something that's really characteristic of Mycoplasma bovis pneumonia, and I think is important for how that disease develops. In addition to pneumonia, Mycoplasma bovis has some other manifestations. So in feedlot cattle, arthritis would be the second common manifestation. The bacteria from the lung tissue go through the blood, seed the joint cavities, and then we get a lot of inflammation within the joint cavities. And this is really a terrible disease because these calves, once they develop arthritis, tend to be very severely lame and also often respond very, very poorly to treatment. We also see middle ear infections. So this is the middle ear cracked open, and just like in young children with otitis or middle ear infections, here we can see that what should be an open airspace is completely filled up with pus. And as a consequence of that, we may see calves with droopy ears like this, or sometimes a head tilt because it damages the nerves that control balance of the head. This would be a condition that is occasionally seen in feedlot cattle, but much more common in younger cattle, dairy calves, or veal calves. So I think this is a unique and fairly important cause of bovine respiratory disease, certainly not a new disease, but compared to many of those other diseases that I showed you, this one is relatively more recently on the scene. Maybe in the last 20 years or so, we've really appreciated that it's a major cause of bovine respiratory disease. I mentioned it causes pneumonia, sometimes with arthritis, sometimes middle ear infections. I think the reason that people are quite concerned about Mycoplasma bovis pneumonia is, first of all, it tends to be a lot more resistant to treatment than other forms of respiratory disease. And secondly, the frequency of infection is very, very high. So again, if we look at this data that I showed you before, I think it's quite typical of feedlot cattle that they have a Mycoplasma bovis is in the blue bars here. So they have a relatively low prevalence of infection when they arrive to the feedlot, often a lot lower than this. But within a couple of weeks after arrival, often close to 100% of those animals develop Mycoplasma bovis infections. So it spreads very quickly between cattle. And when we look later in the feeding period and try and culture lungs, even from healthy cattle, almost all of them are infected with Mycoplasma bovis. But a very important point is it's only a minority of those infected animals that develop a disease, and most infected animals seem to remain healthy. And to me, that's the big puzzle I would like to know what's the difference between the cattle that are infected but remain healthy and the cattle that are infected and eventually develop disease. As I mentioned, the characteristic change within the lung are these nodules of dead cells within the lung tissue, which pathologists call caseo-necrotic pneumonia. The reason I'm telling you all of this is that in that study that I went into some detail with about giving the aerosolized innate immune stimulant, all of the calves that died in the lysate-treated group, all of those calves died of Mycoplasma bovis pneumonia, and they had these very typical lesions with the caseo-necrotic lesions. Again, those nodules of dead cells within the lung tissue. So I began, this is a focus of our current research, how Mycoplasma bovis pneumonia develops, and therefore we ask the question, does prior inflammation, again, when calves are still healthy, does that influence the later disease outcome in cattle infected with Mycoplasma bovis? Probably for 15 years, I've suspected that that is the case. It seems that we never see pure Mycoplasma bovis infection in animals with pneumonia. Always there are other bacteria present that logically could be inducing inflammation. So it's never a sole cause of disease, and we always see these other BRD pathogens present. Sometimes as a pathologist, sometimes I look at lung. Relatively frequently, I can look at lung and find that the lesions that are very typical of Mannheimia hemolytica, the cause of shipping fever pneumonia, if I look in those, I can see these little tiny caseo-necrotic foci that are typical of Mycoplasma bovis infection and identify M. bovis within those lesions. So microscopically, we can look at lung and we can, I think, see within the lesions of shipping fever, we can see the lesions of Mycoplasma bovis developing in there and presumably growing over time and later emerging as the primary disease or the most important disease in those cattle. And then looking at populations of calves, when we look at animals that have died of bovine respiratory disease and compare those with lesions of Mycoplasma bovis pneumonia to other forms of pneumonia, they seem to have a similar time of clinical onset, but the cattle that end up dying of Mycoplasma bovis pneumonia have a much longer clinical course. So it's as if they all start as the same disease, shipping fever, but some of them get better or respond to therapy, and others end up developing Mycoplasma bovis pneumonia that does not respond well to therapy. We did some work to investigate this, and on this preliminary work, we put Mycoplasma bovis onto cells that we cultured in the lab. I should say, with all in vitro studies like this, we don't really know how well that replicates what goes on in the lung of a calf, but it's a situation where we can start to really study and tease out in a very controlled way how Mycoplasma bovis interacts with calf cells and how inflammatory stimuli influence that interaction. So these are the healthy cells that we grow. These are macrophages that we differentiate from cells in the blood. These are healthy round cells. These on the right are cells that have died in the culture dish, and you can see they have lost the kind of the intensity or the clarity of their staining, and they're very irregularly shaped and breaking up into multiple little pieces. So again, I don't want to go into technical details here, but what we found was basically we took these macrophages, these calf cells, we cultured them, we applied an inflammatory stimulus, and then after that, we infected those cells with Mycoplasma bovis. And we found that Mycoplasma bovis, a little bit by itself, stimulates an inflammatory response in those calf cells, but that inflammatory response is much, much more if those cells are first stimulated with the bacterial, the ground bacteria as an inflammatory stimulus compared to if they don't have that initial stimulation. And furthermore, this appearance of death of those cells, it seems very much that the Mycoplasma bovis by itself didn't kill the calf cells, but if the cells were initially stimulated with this inflammatory stimulus and then infected with Mycoplasma bovis, that then the cells died. And I'm very interested in that because we think that that process that we're seeing in these cultured cells mimics what I was showing you in the lung of the calf with the development of caseo-necrotic foci, or little tiny areas of dead cells within the lung tissue. We wanted to look at that same question in calves in vivo. So we took young dairy calves, obtained them at birth with no contact with the dam. So these calves did not have antibodies against Mycoplasma bovis. We raised these calves in isolation, and then these calves were experimentally infected with Mycoplasma bovis at about a month of age. Some of these calves received only Mycoplasma bovis. Other calves received Mycoplasma bovis and the same inflammatory stimulus that I described earlier. And then other calves, and this is a little bit complicated, other calves received both Mycoplasma bovis and live Mannheimia hemolytica bacteria, the bacterium that causes shipping fever pneumonia. But we treated these calves 24 hours later with an antibiotic that we know kills the Mannheimia hemolytica, kills the cause of shipping fever pneumonia, but does not affect the Mycoplasma bovis. So we wanted this transient Mannheimia infection to mimic the transient inflammation or stimulate transient inflammation that fits this hypothesis. These calves did develop lesions typical of Mycoplasma bovis pneumonia. Again, these so-called caseo-necrotic areas within the lung. A caveat with the study is that these calves, at least the calves that were only infected with Mycoplasma bovis, did not develop very severe disease. We wanted that model to have more serious lesions, but we weren't able to attain that. So it's a relatively mild challenge model. And nonetheless, I think it gave us quite useful data. Again, all of these calves were infected with Mycoplasma bovis. Of the ones that did not receive any inflammatory stimulus, of the 8 calves that did not receive any inflammatory stimulus, only 2 of those developed caseo-necrotic lesions within the lung. And in the graph on the right of those calves, the number of caseo-necrotic foci, even in those 2 animals, was relatively low. Whereas the calves that received both transient Mannheimia hemolytica infection plus Mycoplasma bovis infection, all 8 of those calves developed caseo-necrotic lesions. And you can see here that the number of those lesions within the lung tissue is quite a lot higher. And then the bacterial lysate, which is more of a mild inflammatory stimulus, had an intermediate response. 3 of those calves developed these caseo-necrotic lesions with pretty substantial but intermediate numbers of these caseo-necrotic foci. So the summary of this then, in vitro, the culturing the macrophages in the lab, and inflammatory stimulus seems to enhance the subsequent response of the calf's cells or the calf's macrophages to Mycoplasma bovis. And we think that is probably relevant to worsening the outcome of Mycoplasma bovis infection. We think those little areas of dead cells within the lung tissue give this bacterium a place to hide out. So as the calf mounts an immune response, the immune response can't get in and eliminate the bacterium. And similarly, when you treat animals with Mycoplasma bovis pneumonia, the antibiotics can't penetrate well into those caseo-necrotic foci. And that may be one reason, in addition to antimicrobial resistance, why these animals fail to respond effectively to antibiotic therapy. Second point is, in these experimentally and bovis infected calves, it seemed that inflammation increased the likelihood that Mycoplasma bovis infection would cause casus necrosis within that experimental model. Again, that model is not identical to what happens naturally in terms of development of disease, but it is a model in which we can very carefully control a lot of variables. The last part I wanted just briefly to mention is kind of how we think this might happen. This is pure speculation on our part, And we do have some other hypotheses or some other ideas, but these are the two main ones, and I didn't want to make it too complicated. First, we thought maybe inflammation within the lung. When we get inflammation within the lung, we know that proteins from the blood that normally can't enter into the lung tissue, those proteins can leak from the blood into the lung, and perhaps those proteins from the blood or other substances in the blood can help the bacteria grow within the lung tissue. The second hypothesis is that there is a loss of innate immune tolerance, and that's kind of a complicated word, and I'm just going, in the next slide, just explain what I mean by that. This was a different experimental infection model that I haven't shown you, but these calves, excuse me, these calves were challenged with Mannheimia hemolytica bacteria. And I'm just comparing the response in different calves. They were all challenged with the same dose of bacteria, but they end up having different loads of bacteria within the lung tissue. So we grind up about 0.1 grams of tissue. We do this repeatedly to get an average, and we culture that lung and see how many colonies or how many bacteria there were within lung tissue. So this little calf here had 10 to the 8, or about 100 million bacteria within the lung tissue within 0.1 gram of lung tissue. And yet you can see this lung appears healthy. And even when we look at it microscopically, there's a little bit of inflammation here, but I really had to look around to see that. Most of this lung appears healthy, although this calf has 100 million bacteria per 0.1 grams of lung tissue. This is another calf. This calf has about the same load of bacteria within the lung tissue, but you can see these dark areas of firm lung, and microscopically we can see a lot of inflammatory cells filling up the lung. So even though these two calves have different bacterial loads within the lung, they're responding quite different with respect to the amount of inflammation in the lung tissue. And then this little calf has a much lower load of bacteria within the lung. He has about 1 million bacteria per 0.1 grams, and yet you could see that compared to these two other calves, this calf has a lot of inflammation within the lung tissue. These are really dark red, purple areas of lung, very, very firm, and then we've got this mat of inflammatory exudate or fibrin covering the surface. And when we look microscopically, there's lots and lots of inflammatory cells within this lung tissue. So the idea of innate immune tolerance is that different animals exposed to the same number of bacteria, or different animals that have the same number of bacteria within the lung, might mount a different disease response. And that's what some animals might be considered tolerant, like this calf that has a lot of bacteria, but very little sick lung tissue. Whereas a calf like this may be considered intolerant because even though he has a lower bacterial load, he has much greater disease response. This just is the same thing again, just referring to innate immune tolerance. We published a paper just outlining some of those ideas in 2020. You will know that something else happened in 2020, and relevant to this discussion, the idea that the inflammatory state influences disease outcome seems to be true in bovine respiratory disease, but there's very solid evidence for that in COVID-19 disease. So having other lung diseases seems to increase the risk of COVID-19, of severe COVID-19, and it's plausible that these other lung tissues are causing inflammation within the lung. And then when the individual is infected with SARS coronavirus 2, they may develop much more severe COVID-19 as a result of that. And conversely, one of the only early therapy that really made a big difference in COVID patients was the administration of dexamethasone, which is a corticosteroid or glucocorticoid. That's an anti-inflammatory drug. And it seemed that using that anti-inflammatory drug in the very early stages of disease seemed to reduce mortality in patients with severe COVID. So it's as if this is a human model of animal disease, which is perhaps the opposite of how we usually think about the contribution of science to disease. So summary of this then, we previously considered that bovine respiratory disease risk factors suppress defenses, but the evidence we and others have been generating seems to indicate that, first of all, that BRD risk factors cause inflammation in the respiratory tract, even though those calves still appear healthy, and that perhaps that subclinical inflammation is worsening the clinical outcomes when these calves are later infected with bovine respiratory disease pathogens. I want to emphasize that what I'm talking about is very early in the disease state, when calves really don't have any clinical signs, and this is very different than the idea of treating sick calves with anti-inflammatory drugs. This can be helpful as well, but it's a very different situation because these are calves that are already sick. And we think that perhaps this story of harmful effects of inflammation is particularly relevant to development of Mycoplasma bovis infection. Where do we go from here? Not too sure, but we're investigating this line of thinking quite a bit more, thinking about how Mycoplasma bovis pneumonia develops in the context of these harmful inflammatory responses. And of course, the goal would be to try and develop alternatives to antibiotic therapy if we could modulate those inflammatory responses or use knowledge of those inflammatory responses to identify cattle that are particularly at risk of bad outcomes. Then this could have an impact on the occurrence of bovine respiratory disease. So I want to thank graduate students who, of course, do all of the work on many of these projects, collaborators. I've had some great collaborators over the years, and some of them are listed here. And then, of course, funding agency. I've received good support from Beef Farmers of Ontario, Ontario Agri-Food Innovation Alliance, and OMAF, NSERC, the Federal Science Granting Agency, Beef Cattle Research Council, and we've done work with Serapis, the pharmaceutical company, as well.